PIH, post-inflammatory hyperpigmentation. That is something that a lot of people struggle with, and it's very common, especially in individuals with a darker skin complexion. Now, PIH, post-inflammatory hyperpigmentation, can occur with any type of trauma to the skin, and that trauma causes inflammation, or it activates or signals those pigment cells that we have in our body to produce more melanin, and that excess melanin is where we see this discoloration. And also, medical grade skincare can help significantly speed up the process of lightening these marks or helping prevent them as well. From acne, eczema, burns, a scar, anything along those lines. PIH can present itself as a discolored, darkened area. Now, this isn't a true scar, as in it can fade over time. There are things that we can do here at New Age to help you speed up that process or help prevent, if you already have PIH, help prevent that from getting worse. One of the first things that you can do is wearing your SPF every single day. Yes, even in Alaska, and if the sun is not out. Just because you can't see the sun doesn't mean those UV rays are not penetrating through those clouds and causing damage to our skin. So, and just side note, everyone should be wearing SPF every single day, even if you don't suffer from PIH. That's a whole other thing. So anyways, wearing your SPF is vital, very important, especially if you're spending any money to help treat these areas of PIH. You need to help prevent them from getting worse. So SPF is number one. We also can do things at the spa such as a chemical peel. We can do microneedling, and we also have laser treatments that can help treat PIH. Now, the PIH can take sometimes, quite a few months of regular skincare to help them fade, but with time and consistency, they will get better. Filler can be absolutely stunning and beautiful and pretty much undetectable if it is placed correctly. We've all seen patients who have had way too much done and they stop looking like themselves and things start to look distorted, and unique features about themselves start to kind of go away. And I know that that is a big concern for so many patients. So in my practice, I definitely tell patients no frequently if I don't think filler in a certain area is going to look great, or really any treatment if I don't think it's going to be best for you. I will absolutely tell somebody no, and why I think that there is a better option out there. Now, filler can be placed just about anywhere in the face, which is wonderful, but usually when we're seeing different signs of aging, there's a bigger thing going on, if that makes sense. Such as, I think a big one people complain about are nasolabial folds, right? We get this little bit of heaviness right here, and people want to place filler right in there. And really, yes, we can place a little bit of filler there, but is that really what's causing the lines right here? For most patients, no. Typically, when we are seeing more heaviness here, jowling here, it's a natural aging process, right? Bone structure is getting smaller and receding. Our fat pads in our face are separating, getting smaller, and a lot of times kind of falling down and forward. So we get a lot of heaviness and lines in this area, but really to treat it is to treat the structure, to treat that bone, or to mimic that bone that we're losing, to mimic those fat pads, adding support back to tissue when it's lost it. I think it's really important that we aren't just treating what we're seeing, right? Nasolabial folds, that is a symptom of what is actually going on. I think it's important to get down and treat the actual cause of the symptom or the condition that we're concerned with. And so yes, we absolutely do want your nasolabial folds to improve, but that doesn't mean putting a bunch of filler in these areas, because that's when I think people start to look a little crazy. We've all seen the person who looks a little bit like cat lady. Sorry, I don't know if I can say that, but we've all seen the person, pillow face, something doesn't look right. Usually it's because they're overdone. So I like to focus on structure, kind of working my way up and down and then really outward and in. You know, a lot of times adding support to this lateral portion of our cheeks, adding support to our temples or volume back in, even into our medial cheek. A lot of people are afraid of doing too much filler in this area. I completely agree, but we absolutely can get flat here. We lose the support. These fat pads are separating. So when you add that volume back, we're not really lifting, right? We're just restoring where that tissue really should be. So I think filler can be absolutely beautiful. I think it needs to be done slowly. I think it needs to be done correctly. And really you need to treat what is actually causing the symptom or the concern that you have. And, you know, I think it's really important to look at the whole picture. You know, what are we doing for skincare? What are we doing to stimulate collagen? How healthy is our lifestyle? Are we wearing sunscreen? I think it's not just coming in for some wrinkles or a line that you don't like. You know, it really is treating everything that's going on because we're constantly aging. We're losing collagen. And so we really need to kind of combat that and treat everything that's going on. Okay, microneedling. So we offer 2 different types of microneedling here at the spa. And we have a skin pen, which is just plain microneedling. And then we also have a Potenza, which is RF microneedling. And RF microneedling is radio frequency. That means with the Potenza or with the RF microneedling, we're basically adding some heat, right? So we have all those needles, we are penetrating the skin. The RF microneedling is going to go deeper into the dermis, and then we're just doing that little extra punch of heat as well. Now that extra little something is great because it's going deeper. So traditional microneedling or the skin pen, which we have here, is tiny little needles that are causing trauma or injury to the skin to help stimulate some collagen. Now, the skin pen is a really good option for patients who maybe it's like your first treatment of microneedling. I feel like it's a really good way to kind of just dip your toe into what it's like. If you have very mild like acne scars or texture concerns, microneedling can be a really great option for those situations. There's less downtime. It's also more affordable than the RF microneedling. So I think it's a really great treatment to kind of start with. So traditional microneedling versus RF microneedling, you know, who should get what really kind of varies on what are your goals and concerns, downtime that you have, and obviously budget. You know, RF microneedling, the results are significantly, I don't want to say better, but significantly more dramatic than a traditional microneedling. I expect you to know which treatment you should have. Please come see us. We'll do a consult. We'll kind of go over goals and concerns, kind of finalize and customize a treatment plan for you. What we get is, okay, so I'm doing these treatments. Do I have to keep doing this forever? And no, you don't have to do anything you don't want to, but you know, we are constantly aging. We are constantly losing collagen. And so you have to find a way to help stimulate that collagen. And so, of course, you can stop doing these treatments, but when you do, or if you decide that, you're going to see the aging process. So no, you don't have to continue these forever, but we recommend to maintain and to help kind of combat that collagen loss that we're having continuously. Doing a microneedling or an RF microneedling session once, sometimes twice a year can be beneficial. It really just kind of depends on the area, your goals, things along those lines. Now, how soon am I going to see these results from microneedling? Great question, because you know, you walk out of here and you look a little beat up, right? You walk out, you're a little red. Skin might be a little bit sort of touched, more sensitive for, you know, a day or so. And that does get better, you know, as we said, about a week for face, 2 weeks for neck. But an actual change, you know, will take some time, right? This is a marathon, not a sprint, right? So you could anticipate probably in a couple of weeks after a microneedling session, you notice that your skin texture looks a little bit better. Patients, or not patients, family, friends might notice that skin just looks a little bit different, right? But in a good way. I tell patients about a month to expect to see some very, very subtle changes, but give it about that 6-week, 8-week mark, you'll really start to notice some changes. And then, you know, most patients will need anywhere from 3 to 6 sessions. Really depends on area, right? And what device you're using. With the RF microneedling, 3 is pretty average. Some patients will need 5 depending on their concerns. And then with traditional microneedling, I would expect anywhere from that kind of 4-ish, maybe up to 6 range of how frequently or how many sessions you might need. Another great add-on to microneedling is some PRF or even some PDGF. I love both of these. They are growth factors and they can really kind of speed up this process and make your results that much better. PDGF is platelet-derived growth factors. They are lab grown and we apply them on topically after a treatment, and it makes a huge difference in your results. It will speed up your healing time significantly, and gosh, I feel like your skin just looks fabulous after adding on PDGF. And I am speaking from personal experience. I've done many RF microneedling sessions. Holy moly, a huge difference. I love PDGF. The results are unreal. I have been using this for the past 2 RF microneedling sessions that I've done, and it has made a huge difference in my results. Gosh, a nurse practitioner. I get this a lot. I'm not a doctor. I'm not a physician. I'm happy to be an NP. My career started out as a RN or as a nurse. I worked in hospitals. I've worked in quite a few different units. I worked in trauma, surgery, coronary ICU, cardiac surgery ICU. I did a little same-day surgery, kind of like PACU recovery after procedures. So my background, my foundation is as a nurse. And after I completed, my undergrad, I went back to school, finished up my master's, and now I'm a nurse practitioner. My specialty is family. I am an FNP, and I do practice as a family nurse practitioner full-time here in Anchorage. I never thought I would actually work in a family practice, to be honest. I didn't think it was going to be like my thing. I didn't think it was going to be like my passion, but I have been doing it now for 8 years. I'm coming up on my 9th year, and I've been in the same practice the entire time. I was actually even a student here at IPMS. A wonderful specialty. Patients definitely keep me on my toes. There are things every day that I'm like, wow, I was not aware of that, and let's do a little learning together. So it's good. Every single day is different. And not only that piece, but the relationships that I get to build with my patients is just really, really special. I feel really fortunate to be in this field, and in family practice is something. I'll leave it at that. It's something, but it's great. And I can't ever imagine myself not doing family practice in addition to aesthetics. My career is pretty great. I have built a wonderful, wonderful panel of patients. And I get to do a little bit something different every single day. And I just get to talk to people and chit chat. And, I'm laughing, I'm crying. I'm like all over the place with everybody. And it's wonderful. I really wouldn't change it for like anything.